Welcome back to my video series on topics to do with pregnancy and perinatal mental health. My name is Dr. Erin Bow. I'm a clinical and perinatal psychologist, and I also teach hypnobirthing. Today we're up to the letter Q, so I'm going to talk to you about questions for care providers. These are the things that you might want to think about asking yourself, asking your partner before the big day. For whatever journey your birthing takes, sometimes interventions are suggested, and you want to be prepared with your preferences, but also be prepared to question, because sometimes we're not really taught to question. We're taught that the medical community knows best. If somebody's suggesting something, it must be because there's a really good reason and there's life and death at stake. And we're also in a really heightened state when people are giving birth anyway, so we tend to just react out of fear, maybe, instead of reacting out of like calm, clear judgment. So these are things to think about beforehand and be prepared with questions, because following on from the video on knowing your birth rights and having a partner's active role and then acting as your advocate, this is an important one for you and your partner as well, to be both on the same page and informed about what are things you might want to query. So, say for example, an intervention is suggested. Your first question, really, unless it's already been made really, really clear, is there any danger? Is mum, is baby in any danger? Don't assume just because an intervention has been suggested that it's because it's a life or death situation. Sometimes these things happen, that interventions are suggested because of what's beneficial for the person delivering your baby, what's beneficial for the hospital from a business point of view, or they're based on things like somebody's personal experience or their personal opinion, which can be useful, but a personal opinion is not as good as scientific evidence, particularly when it comes to high risk kind of situations. So ask, is there actually any danger in this situation? If there's not, this leaves you open to the next one, which is to ask, what are the alternatives? What else might we try? What else could we do? Rather than rushing straight to whatever intervention might be suggested. Say for example, you are in a situation where your labour is slowed. It's not, you're getting the message that it's not going as fast as other people would like, but you're okay, you're comfortable, it's not an emergency, and you'd like to wait. So you can ask, what would happen if we wait? We wait for a couple of hours rather than jumping straight to doing a cesarean. What would happen if we wait? The next thing to consider is when there is an intervention, sometimes there's a cascading effect. So for example, if you're given drug A, are you then going to need to be given drug B, C, D, and so on through the alphabet to counteract the effects, the side effects from the first drug? So ask, what are the side effects of having this? What is this going to do to my labour? Is it going to slow it up? Is it going to speed it up? Is it going to make it more intense? Is it going to make it more painful? What's it going to do to baby? Is it going to affect baby's heart rate? Is it potentially going to make baby more distressed? What about oxygen levels? So thinking about what are the side effects of doing this, so that you know you have the option of, well, I've got the option of taking this, but maybe this and this will happen, or maybe I could wait, and weighing up whatever decision seems right for you and obviously what's safe for mum and for baby. And then of course the last thing to consider is, what's the actual evidence for doing this? So asking your care provider, what are the statistics on the success of using this method? What's the statistics on what happens if we don't use this method within this time? I don't mean to suggest that your care provider should be like a walking stats book of everything to do with hospital, birthing, intervention, all those kinds of things. I just mean that if someone's defensive and they're not giving you the information that's not, it should be readily available, that might be a cause for concern, because it might suggest that someone is, I suppose, suggesting an intervention for you that's not based on clinical practice guidelines, that's not based on the latest research, that's not based on reviews, ethical guidelines, those kinds of things. You would hope that they would be, of course, and in most cases they are, but it still doesn't hurt to have those numbers available in terms of, okay, so what's the percentage likelihood of this thing happening if we don't do this. Particularly in a situation where maybe you're going down the private route, you have a private hospital, you have a private obstetrician. Remembering our care provider model in Australia is a bit different, a bit odd to other countries in some respects, that a very low risk pregnancy is often still handled by an obstetrician, whereas in other countries you only see an obstetrician if you've got a high risk pregnancy. So I guess it's important to remember, and I always say this to all my hypnobirthing couples, that obstetricians are trained surgeons. They are trying to look for risk and to try and mitigate that risk. Their training primarily is not in low risk physiological unassisted birth. They're there to jump in when things get a bit dicey, and absolutely we need them, and they're so highly trained and are really good decision makers in most cases, but some are not. Some fall into the I'd rather do surgery because I'm comfortable doing surgery, rather than okay, yeah, we could wait and see if the baby turns around and do you know, a breech turn or something like that without using surgery, just because that's their comfort zone. So I guess be thinking about, when interventions are suggested, who is suggesting it and what is their background and what's their comfort zone. It's not to say that it's wrong, it's just to say that might be their preferred method because that's what they've trained in, which makes sense. If you are trained as a surgeon and you're very happy doing cesareans, I won't say do them in your sleep because that would be scary, but you know what I mean, can do them very, very easily, choosing that option is obviously going to be preferred for them, even though what might be better for birthing mum is to wait or use a different position or try something else. So that's just what I'm saying to think about. Thinking about the questions that you want to ask if a situation pops up now, rather than waiting to the day and getting yourself in a flap and thinking, oh, I just don't know what to do. Because more often than not, if you look at the scale of, say, women and couples who've had an unsatisfying birth at one end of the spectrum, through to people who've had a really unpleasant, traumatic birth at the other end of the spectrum, a common thing that pops up is people look back and go, why didn't I question this? Why did I accept this? I'm not really sure if that was the right thing. And it's not to say that you can prevent all of that, but I think good preparation, good decision making, good question asking can sometimes potentially prevent something from being at one end a not pleasant, not an optimal birth, right through to like that could have potentially saved you unnecessary trauma. All right, so if you want anything more resources, information to do with pregnancy, perinatal mental health, maybe you're a birth worker and you're looking for some extra mentoring, you can find me at drerin.com.au. I'll put links below for any particular resources that I've mentioned, and also my social media pages. And I'll talk to you next time. Bye.